And you just listened to a young girl who was saying that the Nigerian community here is totally very angry. It covers all those aspects affecting the various regions of our people. That was the Ijaw country of the Niger Delta of the Federal Republic of Nigeria. He went to several schools. His major academic genesis was at Government College, Ujeli. And
go gather, destroy their food. With the camp and that other camp, some go camp, you don't compensate everybody.
In its key generation sometimes. Today our focus will be on the style of J.P. Clark, a poet and writer, and we shall also be very interested in his poem Akbar Dancer.
Some lives are meaningful, some are empty. Lives that are eventful, with too much meaning and riches to offer humankind. Long after some of these earthly adventures and more, one can still find footprints of these great lives on the pavements of our contemporary lives.
Good evening, you're welcome to the program Green Planet. Good evening.
Good evening.
Who are you?
I'm Fatmata Tambajang Nejalo.
And you come from which country?
I come from the Gambia.
Before coming here, what did you do in your country?
I did quite a number of things, including working with the United Nations Development Program. I also worked with the government briefly as State Minister of Health, Social Welfare and Women's Affairs.
So what are the health problems you think Africa is facing?
Right now we have a number of health issues, and some of them are basic, and I think by this century, if we had the commitment of our political leaders and the international community, those things would have been addressed. Things like malaria, tuberculosis, HIV/AIDS, as simple as malaria. If you look around the world, and particularly in Africa, the children are dying in millions every day. So I would rather think that, and also if you look at the infant and child mortality, infant and maternal mortality, it's increasing, it's not decreasing, despite all the efforts and all the funding that the international communities and governments are investing in those areas.
As health minister, what things did you introduce in that sector in your country?
When I started, I did my best to bring on board the experience I've learned from the United Nations Development Program. Also in partnership with the World Bank, African Development Bank, Islamic Development Bank, and other partners. And what I did first was to look at what was on the ground, because you can't just come and start everything afresh. I looked at what was on the ground, because I knew government had a policy on the ground and programs. I looked at them, and I tried to identify the gaps in partnership with other stakeholders, including communities. And we realized that we needed more efforts in terms of decentralization of the health aspect. We needed more assistance in the area of social welfare, because so many, increasingly, people are becoming very vulnerable because of the declining economies in our countries. I also then encouraged government to develop a new policy that will move the process forward. And policy was formulated in concert with communities to the extent of even reaching out in terms of speaking the local languages, translating to them, so that, because they are the main stakeholders and they need to know what is being developed. They need to direct us. We need to be listeners as policymakers. Once the policy was developed, it was acknowledged by the World Health Organization as a model in Africa. From that also point of view, we tried to support this and the effort of government to decentralize facilities and services, particularly for the health personnel, so many increasingly we realize that people are reluctant to move to the rural areas because of the limited housing, limited facilities and so forth. So we improved the sector too. The other aspect we did was to look at also donors and funding in terms of helping to increase the facilities in the central hospital and also the hospitals in the rural areas, because Gambia has only 3 main hospitals. Others are referral health posts. We developed also a strategy to develop the capacity, strengthen the capacity of the ministry, the department and the health units in the rural areas. And all this we did. We also did some consultation in terms of looking at staff morale. So many times we realize government civil servants are underpaid, and if you want to maximize the capacity of people, you need to really give them the incentives.
But as a former minister, you used to keep the synergy you had with other ministers in Africa. Are you working in any forum that is like focusing on development, childcare, HIV/AIDS, and so on?
Yeah, our program has one of the policy components, the health policy of the Gambia that was developed in 1995 when I became minister, has a major component on maternal and child health. It has a component in HIV prevention and control. We also have tuberculosis, malaria. We have human capacity building. We have strengthening of institutions, and we also have some resources of reaching out to other partners, both domestic, internally and externally, in terms of looking at enriching our programs, particularly drawing on the experience of the Bamako initiative, which is mainly geared towards the Millennium Development Goals, decreasing reducing infant mortality, reducing also poverty, particularly among the vulnerable groups, and helping building the capacities of people through improving, enhancing their own initiatives on the ground in order that they can also overcome their own poverty. Because as you know, poverty remains the major challenge in Africa, and Gambia is not an exception. So through interaction and also international conferences we attend, we bring home, we think globally, and when we come, we act locally.
It has been Arrey Ivo.
And you just listened to a young girl who was saying that the Nigerian community here is totally very angry. It covers all those aspects affecting the various regions of our people. Beth was the Ijo country of the Niger Delta of the Federal Republic of Nigeria. He went to several schools. His major academic genesis was at the government college, Ujeli. And
go gather, destroy their food. With the camp and that other camp, the Songo camp, you don't compensate everybody.
In its key generation sometimes. Today our focus will be on the style of J.P. Clark, a poet and writer, and we shall also be very interested in his poem Akbo Dancer.
Some lives are meaningful, some are empty. To have lives that are eventful, with too much meaning and riches to offer humankind. Long after some of these earthly adventures are no more, one can still find footprints of these great lives on the pavements of our contemporary lives.
Good evening, you're welcome to the program Green Planet.